Patricia Gann with Value Options Program Director will discuss the provider portal and certification requirements for ADHD.
Thank you, Angela. Let's talk about the portal. The provider portal is a secure, user-friendly, multi-payer tool that allows providers to enter required quality metrics not captured in claims data for specific episodes. For our purposes today, we'll be looking at the ADHD episode, those with ADHD primary diagnosis. If you are a new user, you will need to complete the enrollment process to acquire a username and password. Just a word to RSPMI providers, you will need a separate username and password for each individual Medicaid number under which you submit claims. A PCP, a psychiatrist, an RSPMI provider, or a licensed clinical psychologist who can be a COPAP can enter data into this portal. Providers may access their current or past performance reports, including their detailed episode reports as well on the portal. Now, why are we signing on and why are we using this? The portal is being used to enter the quality metrics to pass, and a 90% threshold of all episodes is required to participate in gain sharing. There is a link to the portal available from the Arkansas Healthcare Payment Improvement Initiative website. Just click on the section labeled Provider Portal where it says Learn More. This will take you to this screen. From this screen, you can access a guide that explains how to read the reports with illustrations, a step-by-step instructions into using the portal, and also contact information for customer support for AHIN and for the Arkansas Payment Improvement Initiative. If you already have a username and password, you can click on the Portal Access button. You may now enter your username and password to log on to the portal. If you do not already have a username and password, you can click on the link for APII access and it will take you to the Advanced Health Information Network Arkansas Payment Improvement Initiative enrollment form. Complete this form and then mail, fax, or email the form as directed to get your password. Once you've logged on, you'll see this screen. Please select your payer, facility name, and provider. Then enter the beneficiary's first and last name and their Medicaid ID number and date of birth. The date of service is the first date of service for this beneficiary after October 1st, 2012. You'll also notice that there are two questions on here. Have you previously treated this patient for ADHD? And is this a severe patient who requires level 2 care? For the purposes of today, we're going to say to the first question, have you previously treated this patient for ADHD? We're going to answer yes. This is based on current active beneficiaries. In other words, were you providing services to this beneficiary prior to 10/1/2012? If you have previously provided services to this beneficiary and they have discharged from treatment but have returned to treatment after October 1st, 2012, then the answer to this question is no. If you answer no, you'll be prompted to complete the quality assessment that we'll look at in a moment. But if you answer yes, then you will need to complete the continuing care certification. The continuing care certification requires that you state that the patient has ongoing symptoms and impairments, that you provided psychoeducation to the parent or guardian, that you're providing guideline concordant care or medication management, you've documented the rationale for any treatment outside those guidelines, and you've alerted the PCP. Though they're not required to physically complete this form, the certification may only be done by an MD or licensed clinical psychologist. So the signature in that box can only be that of an MD or a licensed clinical psychologist. Though RSPMI organizations have many other providers which provide services, please remember that still a PhD or an MD are required. If you answer yes to is this patient severe or are you escalating them to level 2, then you will need to complete the severity certification. The severity certification requires that you answer the questions or click one of the boxes, that there has been an inadequate response to medication management, there have been severe side effects of medication, that there are major environmental or familial complications, or you enter another reason why this person or this beneficiary is being escalated to level 2. And at that point, then there would be the entering of the MD or psychologist's signature again. And then you would submit this episode data. If you say, is this person severe? No. And you have not previously treated this beneficiary. You began treating them after October 1st, 2012. Then you will not be able to complete a severity certification until the beneficiary has been treated or evaluated for 60 days. You can see the frequently asked questions on pages 6 and 7 on the website in reference to the vision and hearing screenings. Reference the Medicaid Child Health Services EPSDT manual for who may complete the screening. Sufficient documentation would include the location, provider name, and date of completion of the hearing and vision screening. Please also remember that a diagnosis of ADHD requires an in-person assessment and reports from at least a minimum of 2 settings. That those symptoms which have lasted for at least 6 months include 6 symptoms of inattention and 6 symptoms of hyperactivity, impulsivity, and that the onset is prior to age 7. There also needs to be screening for common comorbidities using a broadband diagnostic or similar tool, a family history, and evidence of ongoing communication with the PCP. This slide in the portal also contains the DSM guidelines for ADHD. We've already talked about the first ones, the 6 symptoms and the 6 symptoms in category A and B. Then going to the next page on this, note that the symptoms have to cause impairment that is present before the age of 7, that there's clear evidence of clinically significant impairment in social work or school functioning, that the symptoms don't happen only during the course of another diagnosis such as pervasive developmental disorders, schizophrenia, a psychotic disorder, or other disorders, and that those are ruled out using the broadband assessment tool. Then at this point, once again, you would submit the data, the episode data. So let's go ahead and wrap all of this up. The quality assessment is for all new patients entering the episode after October 1st, 2012. It's to be completed by the provider who will be delivering care, and it encourages a thoughtful and high-quality assessment and diagnosis, remembering that assessment codes are not included in the episode cost. Appropriate diagnosis of comorbid conditions is encouraged using a thorough assessment and broadband assessment tools. The continuing care certification is required on all recurring ADHD primary beneficiaries within the episode model. Beneficiaries in care prior to October 1st, 2012 are also included in the continuing care certification. It's completed at initial recurrence in every 12 months, and it's completed by the provider who will deliver care. It includes certification of adherence to basic quality and guideline concordant care and reevaluation and management at the physician's level. The severity certification is required at escalation to level 2, either the initial or a recurring escalation to level 2. It's required at that escalation in every level 2 episode thereafter, and is completed by the provider who will deliver care, an MD or a licensed clinical psychologist. And it requires certification for those in Level 2 by a physician providing Level 2 care.